Good evening, Chelsea. Good evening, everyone else that's joining us. Hi, Dr. Q. See you there. I'm just going to invite, we're talking to Dr. Q this evening. There we go. We're going to accept. There we go. Dr. Q, how are you?
I'm good, thanks. And yourself, Leanne?
Good, thank you. You make things so easy for me. I don't have to worry. You just come online, you send me the request, we're live, no issues. Love it.
Okay. I thought that's the normal. I thought that's the norm and the expectation.
So thank you for that. So we're talking to Dr. Q, and you can see by the number of those that are live that has joined us now. Very popular, Dr. Q. People love you. Everyone loves you.
I love them too. They know I love them.
I know it, but I think it's also the topics that you bring across, and especially this miscarriage one is quite a huge one. And
Yes.
it's almost a devastating one to talk about, or sad, real sad topic to talk about.
Okay.
Yeah.
No, it is.
So tonight for those who just joined us, we are talking to Dr. Q, Dr. Q Cele, and she's from the Family Matters Fertility Centre. Am I right?
Yes.
Got it right. Okay, so we're talking about what can we do to prevent a miscarriage, and also multiple miscarriages. So yeah, that is our first question. Our first question is what is a miscarriage?
Yeah, so before we speak about prevention of a miscarriage, I think it's important to know what exactly is a miscarriage, because you'll find women who've lost babies before saying that I've had 4 miscarriages. And when you take a thorough history and listen as to when did this happen, you find that they actually didn't have miscarriages. They actually lost babies. It's babies that count. They probably had a stillborn or something like that, and they define it as a miscarriage. So, and it's also very important to know the definition of a miscarriage, because it depends where you are. And this is where I really would love women to take cognizance of, especially those who are trying to fall pregnant. I hope everything is clear. My lighting, I can't do anything better. I'm on holiday, by the way.
Oh, wow.
When I'm on vacation, so I'm sitting in my hotel here. I just had to make it work,
Wow.
So I hope I'm
Thank
audible
Yes.
and visible.
No, perfect. Everything is perfect, doctor.
Great. So it's very important when you are, especially when you're trying to conceive, to plan for this pregnancy as well, before you just worry about just getting pregnant. This is because one, a miscarriage is a loss of a pregnancy that has not reached a viable state as yet. So it's a loss of a pregnancy before viability. Now, what do we mean by viability? When is a baby viable? Or what do we mean when we say a baby is viable? Now, a viable in a neonatal ICU setting, it's a baby that you can ventilate and they have a chance of survival.
Yeah.
Where the lungs have developed but probably not matured. Now, again, it depends now where you are. Viability is different in different countries, and viability is different in the same country, especially in South Africa. Yeah. So in first world countries, they say a baby is viable once a baby has reached 20 weeks. So we're talking in the UK, if you are in USA and you have a 20-weeker pregnancy, you know already that, look, I have a baby where if anything happens, this baby has a chance of survival in NICU. So that's viability. If you lose a baby before 20 weeks, then there it's a miscarriage. But here in South Africa, according to WHO, the World Health Organization, viability is from 24 weeks, or a baby that is in utero 500 grams. So if your baby has not reached 500 grams or is less than 24 weeks and you strike a problem in your pregnancy, unfortunately, it is regarded as a miscarriage. Example, you are 23 weeks pregnant and your water breaks. It's regarded as a miscarriage. You are 23 weeks pregnant and you develop severe hypertension that to save your life, the pregnancy must end. You are terminated and it's regarded as a miscarriage. So that baby is regarded as not viable. Now, in South Africa, in our government sector, a baby has a chance of survival in neonatal ICU once they are at least 700 grams and above. So if you have a 500-gram baby in South Africa government sector, that baby does, hardly even qualifies for neonatal ICU. In the US, yes. In private sector, yes, the baby can stand a chance. And they need to have very good neonatal ICU services, very good pediatricians as well, for that baby to survive. I have a baby that we delivered because the water broke, and the baby was 500 grams. So that is a miscarriage according to definition. According to WHO, it's a it's not a miscarriage. We can try, but according to South African public sector, we don't have facilities, ventilators for a 500 grammer. So fortunately, that patient had to actually be transferred from Nelspruit to where I'm working at Netcare Unitas Hospital. And I took over that patient with all the risk, and I did say there's risk of 1, 2, 3, 4, 5, even losing your womb, even losing your life if we continue with this pregnancy and things are happening like this. This was a miscarriage by definition, because in the public sector, the baby has to be at least a kg, 1 kg, meaning the baby has to be at least 28 weeks to be viable. So the majority of our viability is 28 weeks, 1 kg and above. You may be lucky, depending on which hospital you are in the government sector, if you've reached a 700-gram pregnancy or 26-weeker, 27-weeker. But anything below that, it's a miscarriage. But if you are in a good facility, so this is why now I say mothers who are trying to fall pregnant, because you are in South Africa, not that it's a must, but let's just be real. Because you are in South Africa, afford a good medical aid. That will afford you a good obstetrician and gynecologist. That will afford you a good pediatrician and a hospital that has good NICU facilities. I've been really saddened where I would help a person to fall pregnant and then comes a condition during the pregnancy, 24 weeks or something, and you find that their medical aid does not even allow them to stay in my hospital, will not pay for the hospital I'm working for. Now they have to go to the government sector. Just last week, I had a lady, 24 weeks, 4 days pregnant. And her blood pressure just shot up like this. She's never had blood pressure before. At 24 weeks, she had what we call preeclampsia. Shot up like this. Her platelets, which are the blood clotting cells in your blood that causes blood to clot, they dropped. A normal is 450 and above. Hers were sitting from 65, went down to 40, dropped down to 35 in a matter of hours. We could not continue with that pregnancy to save her life because she could bleed in the brain, have a stroke, or die. So that pregnancy needed to be terminated at 24 weeks, 4 days. Spoke to other hospitals, they said, and other colleagues, they said, okay, we need to terminate that pregnancy. I said, whoa. Like, we've been through a long road. Guys, can we please, And we had to make ways and chance and get medical aid and motivate. It was a lot of work, motivating for a 24-week, 4 days.
Yeah.
Eventually, the patient was able to stay in my hospital with the best neonatal ICU facilities. Not to say that guaranteed, the baby will survive, but to say we will do our best to try and save both mother and the baby, because she's come a long way. 6 months is a long way. Ask a woman who's 24 weeks pregnant what she's been through.
And
You
especially
understand?
when you've been struggling to
And
conceive in the
especially
first
when
place.
you've been struggling, and then now you're here, like you've just passed the halfway mark, and now they're saying, we're rubbishing everything. Hearing those words just was like a stab in my heart. We delivered a baby who is 417 grams.
Wow.
So now we are talking first level, first world country level of care. I delivered a baby who's 417 grams, who is still alive a week after and is doing well in neonatal ICU. According to definition, sorry. Had to just let people know about what are we talking about when we're talking about a miscarriage. Let's just define it properly, and then know that when you're going through a pregnancy, try and strive for the best level of care. Now, sometimes, not everybody can now afford that first class, world class level of care. So that's why we're having a topic like today as to what can we do? What can I do to make sure that I don't end up there? Because if I can tell you, this patient who just suddenly developed hypertension, if I can tell you her history, then you will understand, these were the different causes, or these were the risk factors that she had for her to be in this situation. That's what a miscarriage is.
Wow. So second question is, what are the different causes of miscarriages?
Okay, so there are many, many different causes of miscarriages, and the majority of them is actually unexplained. So we can't say for many of them why a woman actually having miscarriages. But I can say, though, on a hopeful note, that even in those ones that cannot be explained, more than 65% of them can actually fall pregnant and keep a pregnancy. More than 65%, even if we can't explain it. But for those that we can explain, there are some that we can do something about it, and there are some that we can't do something about it. So some, like congenital abnormalities, where a baby is born or the baby is made abnormal, or genetic abnormalities where the baby is actually abnormal in terms of chromosomes, where there's abnormal division of the chromosomes. We're talking basic at the DNA level, at the formation level. It could be a natural, it could be during IVF. It's a chromosomal abnormality that the baby has, and that's the most common cause of miscarriages, especially in the first trimester. Then there is also now causes like advanced parenthood age, which would mean the mother is above 40, especially for mothers above 40. Common age is 35 and above. Average age is 37. So when the mother has an advanced age, or a dad has an advanced age, and for men, it's usually above 55. So this also has to do with chromosomal abnormalities, because the eggs or the sperm is so old that it does not divide properly. Then it has a factory fault. There's either extra chromosomes in the baby or a shortage of chromosomes, and then the development of the baby becomes abnormal. So those are the causes of mostly early miscarriages. And then you can look at the womb itself. In the womb, there could be congenital abnormalities, which are things that women are born with, like and how big the fibroid is. So we need to exclude those things. Again, on the womb itself, other women have not first trimester miscarriages, but second trimester miscarriages. And these second trimester miscarriages are usually associated with a condition that we call uterine cervix incompetent cervix, or incompetency of the cervix. So an incompetent cervix is a cervix that just opens up and lets the baby out before viability. So it usually happens in the second trimester. So women who would usually lose babies when they are 12 to 26 weeks pregnant, or even 24 weeks, depending on what your viability level is. So between 12 to 24 weeks, if women lose pregnancies around that time, and there's a typical history that comes with an incompetent cervix, then we are able to tell that, okay, the problem is the cervix, and the good part is there's a solution for it. So those ones we don't like, but we prefer. You know, if there's a problem and we can solve it, we feel like we heroes, you know, we little gods, or God's extended vessel, like, we can fix this, you know. So that's an incompetent cervix. And then there's also conditions of the autoimmune system, a condition called antiphospholipid syndrome, which is associated with antibodies and then leads to blood clotting. Now, this blood clotting stops the baby from getting blood. Baby doesn't get blood, baby dies inside, unfortunately, just simplified. So antiphospholipid syndrome also we can investigate and treat. And other conditions are chronic conditions, things that you are well aware of that you have, like diabetes, like hypertension, like hypo or hyperthyroidism, thyroid issues. So those are chronic conditions that, when uncontrolled before pregnancy and during, can lead to a miscarriage. And other things are trauma, which mostly is beyond your control. You know, no woman can cause a car accident or roll down the stairs deliberately, intentionally, you know. So trauma is almost inevitable most of the time, unless maybe the woman is stressed and suicidal. We hope not. And sometimes, to a certain extent, women with polycystic ovarian syndrome as well, unfortunately, can find themselves having miscarriages. And this is mostly because of insulin resistance, or them ending up actually being diabetic due to the polycystic ovarian syndrome. So the causes are many, and they're variable, but those are the common ones, or the ones that are at the top of my head.
Okay, thank you.
You look at the size, you plan how many seeds, what do you want to plant, is this soil good enough? And you go and you tilt the soil, you remove all the rocks that are in the soil, you put in the manure, you get all that manure, you go buy manure and you pour it in your, you know. So there are certain things that you, as a womb carrier as well, who wants to have a sustained pregnancy inside you, you need to be tilting that soil, removing those rocks, and actually examining that field even before you fall pregnant. Go and get that field examined, and then putting in that manure through you into the bloodstream and reaching your womb and reaching your ovaries. Okay, so that's how we should look at pregnancy and the things that we can avoid. So if you wanted to plant in the field and there are children, it was a playground for children, then you put a fence and you tell those children, don't play in this ground anymore because I'm planning on this. So it starts with us. Number one, if there are habits habits like drinking alcohol and smoking that we enjoy so much, and it's been a play field, a playground, it's normal, that's where it starts. That's where it stops, because these things affect the blood supply to the womb. It affects the blood supply to the baby, and then it affects the baby. So you don't want your baby to be affected. Reduce and stop. So if those habits are there, it starts with you, you're thinking, okay, next year I would like to fall pregnant, then yes. If it's a planned pregnancy, please start reducing those habits. And then two, it's an issue of age, but that we can't do much about. But for women who are listening, they must know that women that are 40 years and above have actually a 74% risk of having a miscarriage. And that's actually quite high. So I know women are actually frustrated by relationships because unfortunately you can't fall pregnant on your own. I'm sure if we could make ourselves pregnant, we would, hey? But unfortunately, it does take two to tango. So some women are still waiting. Some women are just delaying because they want to climb the career ladder and or the corporate ladder. So I would recommend that whilst they are young, then let them freeze the eggs, because then the eggs cannot do the things that are supposed to be done by the eggs when the baby needs to be made at the age of 40 and above. So rather, they come see people like us, fertility specialists. Listen, I'm 34. I know I don't want a baby in the next 5 years. Can I please freeze my eggs? And then we freeze your eggs. They remain 34 up until the day you need them. Okay. Yeah. So that's another way of actually preventing miscarriages or the risk of miscarriages. So with lifestyle as well, you need to watch your weight, because with weight comes a high weight is a high body mass index, which is a high weight for your height, increased weight for your height. And this is related to the risk of hypertension in pregnancy, the risk of diabetes in pregnancy, the risk and that hypertension can lead to preeclampsia, stroke, etc., loss of mom or baby, sometimes both. And it can also lead to what's the other thing I had in my mind? Wait. Yeah, but I just lost that thought. But it's very important to actually lose weight before you fall pregnant, because a lot of women feel, I'm going to be fat anyway, so I might as well just continue, you know. Even the way we actually monitor your baby is very difficult, because the sonar goes through the abdomen. And if the abdomen is so thick, you know, we can't even see your baby very well. And the risk of things happening in there, and we cannot actually assess your baby very well, is actually high. So very, very, very good tip. Women, please take it seriously. Please lose the weight before the pregnancy. You are reducing a lot of complications that are associated with increased weight, and one of them is miscarriages as well. And then if you know that you have chronic conditions like diabetes and hypertension and thyroid issues, make sure that they are under control before you fall pregnant. Don't just think of a pregnancy and go ahead with it. Diabetes can cause congenital abnormalities, and these are early on. You know, we're talking between the period of 4 to 8 weeks when this baby is being formed in a very high sugar, high insulin environment. Then that heart becomes abnormal, that spine becomes abnormal, a lot of things become abnormal, and then the body can pick it up and discard that baby as not quality for life. So if you have diabetes, make sure that you get it controlled 3 months prior. And women with polycystic ovarian syndrome, they are recommended even to start with metformin at least 3 months before falling pregnant. And every woman who's planning on a pregnancy, 3 months before falling pregnant, they must start taking folic acid. And that's why now contraceptive tablets, I'll mention the brands. We used to have just Yes, now there's Yes Plus, and then even that also I think has been discontinued or something. But those companies realize that women do not nourish themselves well. They don't take folic acid. Folic acid prevents neural tube defects, which are congenital abnormalities, which commonly would lead to miscarriages. So 3 months before you fall pregnant, you need to be on at least 400 micrograms of folic acid. So again, I would say if you are on that and you've got things like PCOS, at least be on supplements like myoinositol, D-chiroinositol, and all those ones that actually add to the quality of the eggs that will be making the baby. 3 months before pregnancy, and metformin also 3 months before pregnancy. This is you tilting the soil. This is you putting in the manure before you plant that seed. Okay, so chronic conditions are very important. And then go for an examination. When you're planning a pregnancy, you don't know how your womb even looks. You know, maybe you're sitting with a big fibroid there that will cause problems in the future. Maybe you have an asymptomatic fibroid. Go for a checkup. Go see a gynae. Let them do a proper sonar on you and confirm. Maybe you have polycystic ovarian syndrome and you're not even aware it. Then you need to be on certain supplements before you even plan your pregnancy. So go for that pelvic exam. Let them clean out the field. If there are rocks in there, let them remove the rocks and then give you the supplements to start taking and prepare your soil for a safer journey going through the pregnancy. And then if you've had recurrent miscarriages, then a hysteroscopy is recommended, where we put in a camera through the vagina into the mouth of the womb and we view the room. We check that, oh, there's the fallopian tubes, there's no polyps, there's no fibroids, there's no septum that is actually affecting the pregnancy. So that is also very important, that we go in and view from underneath. There's no cuts that are made unless there's certain complications, but there's no cuts that are made. It's just the camera to go in and view the field and make sure that the field is actually fine. And if we find adhesions or what we call Asherman syndrome, we are able to liaise or cut the adhesions just so that the cavity can open up. And it depends, there's different grades as well. But hey, looking into the womb does come up with some answers as well. And then there are blood tests that are done to look for things like antiphospholipid syndrome. So if a woman has had 2 miscarriages or more, very important to test for antiphospholipid syndrome. And the good thing about it is once it's detected, we do give women anticoagulation therapy that stops these blood clots from stopping the blood supply to the baby. And then women go to term pregnancies, which is very wonderful. It's a good, really, really good outcome to see. So there's hope, you know, especially in a lot of conditions. And if it is cervical incompetence that I spoke about earlier, where the womb just spits out the baby, then at 14 weeks, we recommend a stitch. We put a stitch in the womb, tighten it up and say, you shut up until we say you open your mouth. Like you keep that baby in there until we say we are ready.
Yeah, my mom used to get that all the time. So every time she conceived, she used to get the stitch, a Shiraka or something like that. Am I right?
Yes,
yes. So she used to say to me, and then your daddy had to sleep under the bed for those few months. So that's what has happened. So I definitely remember that.
I'm sure he didn't like that stitch part, but the rewards were great.
Yes.
He got his kids. You see. So yeah, so that's a cervical stitch. There's different types. There's the Shirotka, there's the McDonald's, and there's one that we do laparoscopically as well. So yeah, that's basically that. And for some women, we keep checking if the history is not too clear. We keep checking. Instead of putting a stitch, then we can give you progesterone that you can take during the pregnancy. And it also helps to stop the cervix from shortening and then opening and letting go of our precious cargo. So those are the things that can be done to actually prevent a pregnancy, things that can be done by the patient themselves. and things that can be done by us intervening or investigating and intervening and assisting to keep that pregnancy to term, at least.
Okay. Thank you very much, Doctor. Just one small question is, so in when it's early, just before 12 weeks, I would say, and a lot of times that's when women start spotting and unfortunately have miscarriages. So you're saying there is, in most cases, when it's something that when it's not, okay, is there something that's recommended for that? Like just before when they start spotting, that it could be a miscarriage?
That's called a threatened miscarriage. Okay, there's
Yeah.
different types of miscarriages. I didn't want to cover the whole topic because
Yeah.
the topic was very specific, prevention of miscarriages. But there's different types of miscarriages. So a threatened miscarriage is a miscarriage where, yes, a woman can see signs of spotting, but when a sonar is done, there's still a heartbeat. So we take it that maybe the womb is irritable. We need to make sure that there's no urinary tract infection or vaginal infection or what we call cervicitis. And then we check the woman's progesterone, and then that's when women are given progesterone. There's different types, but there is progesterone that actually can be given if there's a threatened miscarriage early in the pregnancy.
Okay. Thank you so very much, Doctor. And thank you for taking time, even on your vacation, to come and talk to us. So it's I really love that. Thank you very much for that. If you can just please give everyone your details of where they can find you and your Instagram, that sort of thing.
Yes, you can find us on Instagram. We are Family Matters Fertility underscore Center. Family Matters Fertility underscore Center. And on Facebook, we are Family Matters Fertility Center. And on Twitter and on TikTok, we are Family Matters Fertility Center. And we are based in Centurion, Pretoria Centurion at Netcare Unitas Hospital. And our phone number is 012-644-0299. And we wish women all the best with their bundles of joy.
Thank you very much, Dr. Q. Guys, I think a lot of people are asking us to please save this. It will be saved on our Instagram, but you can also find all the videos over on YouTube, and it's Fertility Solutions SA, and you'll find all our videos there. You can watch it at any time. So thank you very much, Doctor, and thank you everyone for joining us. Have a great evening. Bye-bye.
You're welcome. Bye.
Bye.